This national health insurance scheme is really very important for everyone in Uganda because of our medical situation. And it should have done long ago. Should have been done long ago. And really we are appealing to the President of Uganda to assent his signature, to append his signature on this. Because at least we are happy that the parliamentarians have accepted. So please, President, we request you to do us a favor and also append your signature on this. Many people are suffering. We have a lot of diseases, communicable and non-communicable diseases, which attack us every now and then. And we die of these diseases. But if we have a national health insurance scheme, I think it will have reduced on the death rate and it will improve our mortality rate. Thank you very much. This is an appeal to you, His Excellency, the President of Uganda. Thank you.
I want to thank God that the country of Uganda is thinking about the National Health Insurance Scheme. I have seen people on TV, and I even hear them on our local radio stations soliciting for funding so that they go for medication, and especially poor people. And I've seen people coming, trying to help people to get such kind of medication. But if we had health insurance, then all those concerns could be taken care of. Both the one who has the money and another one who doesn't have money. In case someone has little money and he thinks that he can't take care of himself health-wise or to get medication, with health insurance, everything would be taken care of. So, in fact, we are late because people have struggled. People are scared of going to health centers or hospitals because they know they don't have money. Others who have gone to private clinics, they have been given bills which they even don't know what to do with them because they can't afford the bills. So with health insurance, all that would be taken care of. Nobody would be worried about what to do when someone falls sick because everything would be taken care of. So the earlier we do this, the better.
However, my major concern is for us to prioritize the call for action. Whatever the critical stages that are remaining, the gaps, and things like that, like those ones, we shall go ahead to kind of continue to address them. Otherwise, we should not keep lagging behind on this very primary and core service that is needed for safeguarding life. Indeed, the welfare of humanity is something that's very important. The welfare, generally, in our country, so that this implementation of this comes on, whatever the remaining gaps are.
Goal number 3, which means that everyone should access health services. So when you get this scheme, this new financing mechanism will help our people to achieve or to get the health care, even those who are poor. So I think when we start this scheme, it will be so important to everyone in the country, whereby the poor will also achieve, will get the medication, and also the rich. As I said, we have 3 categories of people: low-income earners, unemployed people, and also the high-income earners. So this scheme, I think, will be helping everyone to get the...
My name is Pastor Bamoyana Samaro Kizito. I am the Director of Health Services in the Seventh Adventist Church in Uganda. I am been so much privileged to be here in this meeting to learn about this health scheme. I think it is very, very important, and I think it is long overdue because it is providing for the safety, for the health of the Ugandans. As a country, as a church, as leaders, we want healthy people. Some of us have got the privilege to be having some health schemes where we are being covered by our organizations where we work. And we can understand the security, the peace that you enjoy when you know that you have a health cover. You can walk and move when you are secure. So I think this is important because it's going to provide this safety for all our Ugandan people. And I think it's going to be a tick and starting a very good starting platform for the new government that is coming in power. So I would really call upon the president not to delay, because by passing this bill, it will give his government, our government, a tick, and it will be beneficial to all people. So it is a very good policy, and I sincerely support it on behalf of Seventh Adventist Church.
I believe that the National Health Insurance Scheme Bill will benefit Ugandans a great deal. This bill has delayed over 34 years. And that in itself speaks a lot. When you compare the health status of the nation of Uganda, our citizens, with the neighboring countries and the rest of the developing countries and the entire world, we are still getting there. And the bill will equalize the health needs for the entire country, for all the citizens. Because if there is something that can make me access the same health services that a certain category of people receive, which I don't, simply because the bill enables me to receive, that's a great one.